Oh, yes, yes. I know when I first saw him, I forgot he wasn't on the board anymore. I would have run him code, but I don't think that's correct today.
I've got 6 o'clock, so we'll go ahead and get started. At this time, I call the Randolph County Board of Health May 10th meeting to order. We've got one of our members joining us by Zoom, so Hope, thank you for being with us. And guys, it's good to see everybody back face to face. And we've got several staff members with us tonight, and we thank you for being here. And then we've got a former chair with us tonight also, Mr. Lee. We appreciate you being here with us as well, so thank you. This time we'll open up the public comment period. I did not receive any requests for public comments, or is there anybody in the group that wants to make a public comment? Hearing none, we'll close the public comment period. All right, board members, in your packet, you should have received the minutes. A couple sets of those. First will be the March 8th, 2021 regular meeting for the Randolph County Board of Health. Do I hear a motion to approve those minutes as presented?
I move to approve the minutes as presented.
All right, got a motion by Robert. Do I hear a second?
Second.
All right, Courtney. I think since we've got a mixed group, we probably need to, since we've got Hope on Zoom and then the rest of us here, let's just go through. Julie, I'll start on your end and just say your name and I, if you approve of that.
Julie Mabe, aye.
Courtney Austin Wilson, aye.
Robert Brown, aye.
Marty Trotter, aye.
Max Semi, aye.
Carrie Hampton, aye.
Alan Ferguson, aye.
Mary Ann Evans, aye.
Amy Williams, aye.
And then Hope.
Hope Haywood, aye.
Okay, thank you. Next item on the agenda is approval of closed session minutes from April 19th, 2021. Do I hear a motion to approve those as presented?
I move to approve the minutes as presented.
All right, have a motion by Robert. Do I hear a second?
A second.
All right, Mac, second. Again, we'll go through the same process. Julie, we'll start with you.
All right, Julie Mabe, aye.
Courtney Austin Wilson, aye.
Robert Brown, aye.
Marty Trotter, aye.
Max Semi, aye.
Carrie Hampton, aye.
Alan Ferguson, aye.
Mary Ann Evans, aye.
Amy Williams, aye.
Hope?
Hope Haywood, aye.
Okay, thank you. Motion carries. All right, moving on down to the agenda, we've got Susan Hayes to present the fiscal year 2021-22 budget for review and approval. Susan?
So, good evening, Board of Health. It's good to see everyone here. You all, in your packet, you should have the pieces I'm going to go over, but there's, I think your book, I'd ask, we'll do this different next year. You should have a page that looks like that, very front. Do you?
Yes.
Yes. Whoops. So on that page, if you will look, it shows how much in additional funds we are going to be asking for. And that's a piece I want to go over for you. So we will be asking for $150,934 more dollars in the fiscal year 2021, 2022 budget. That's over what we requested last year. The reason we are asking for that amount is because health insurance with the county and retirement increased. Retirement increased by 1.6%, that's state retirement, and health insurance increased by 7.5%. So health insurance went from $800 per employee to $860, and that's about $10,320 per employee that the county pays for our employees. We have 800 or so employees, so that $85,896 is a reflection of health insurance and retirement increase. There were merits that we get every year that we don't get until we're in the year. So those merits were awarded in the previous year, and so we'll carry that forward, and that increased our budget by $15,038. And then we had truly the only ask that we had for this year's budget was we asked for $50,000 more to go in the medical examiner's line item. Deaths in Randolph County have increased as they have across the nation. They've increased in North Carolina about 16%. They've increased, if you look at CDC, I think CDC said 18% in the nation. And then I read something else where it quoted a 20% increase across the nation in 2020 over 2019. I don't have data for Randolph County, what the increase in deaths were during 2020 over 2019, but I can tell you that our increase in medical examiner cases went up by 17%. And so we are the registrar for deaths in the county, and we are billed by the state medical examiner's office for any cases that go to that office. And so to honor those requests, we needed to increase our budget by $50,000. So any questions about that? That is the only request, like I say, the only real request from us that's because of us. The other things are operational costs that the county will have to take care of anyway. So I'm requesting approval for this budget for our presentation at the county commissioner's budget hearing in June.
Okay, you've heard comments from Susan about the budget request for next year. Are there any other questions from the group? All right, hearing none, do I hear a motion to approve the budget as presented?
I move to approve the budget as presented.
All right, Robert made a motion. Do I hear a second?
I'll second the motion.
It's Courtney, second. All right, we'll start with you, Julie, and go back through this process.
Okay, Julie Mabe, aye.
Courtney Austin Wilson, aye.
Robert Brown, aye.
Marty Trotter, aye.
Max Semi, aye.
Harry Hampton, aye.
Alan Ferguson, aye.
Mary Ann Evans, aye.
Amy Williams, aye.
And Hope?
Hope Haywood, aye.
Okay, motion carries. Thank you. Next on the agenda, we have the fiscal year 2021-2022 fee schedule for review and approval. Susan?
Okay. You have a copy of our fees as in your packet. And if you look at those, you can see that the first set of fees that you're going to review are those for our clinic, our family planning clinic, our general clinic. The first few pages with the columns shows how we do compare. We look at other health departments throughout North Carolina, particularly in our surrounding area. We see what their fees are. We look at the market to see if we're appropriate with our fees. We also compare our fees to what Medicaid pays. Our fees need to be a little above Medicaid. So you can see the ones that we are recommending for increase on the fourth page over is clinic fees, and it's, you will see the recommended change in fee in red. It shows the current fee, the recommended change, and then the last time it was revised, so you know how long it's been the same. I'm not going to read over each and every one of those. You can look at those, but I will be happy to answer any questions if you should have any.
I have a question.
Yes, ma'am.
Go ahead, Hope.
Can you hear me?
Yes. Yes, we can hear you.
I just noticed something called quantiferon. It's new.
Quantiferin, yes.
It was $200. And I just wondered what it is.
You correct me if I'm wrong. It is related to tuberculosis. Right now, when we're dealing with a tuberculosis case, we can do a TB skin test that has to be read within a certain time frame. This is a blood draw that is done, and we don't have to read it again. And so it's to our advantage. Throughout North Carolina, there were a number of health departments that were able to get the ability to do that from the state, but we were not one of those. And we would like to be able to have that. And what brings this up is we just had a new TB case in the last 2 weeks. There were 20 people that had to be tested for tuberculosis because this woman had lots of folks around, and some of these folks did not live in Randolph County. And so being able to go read an arm that's had a TB skin test put in it was not, was kind of tricky. And so this would help us in the long run if we were able to do this. So that's a great question, Hope. Thank you so much.
Okay, anybody else with a question? Okay.
Okay, so the next set of fees that we're going to look at are, our dental fees. And again, we don't just decide we're going to charge this. We look at all the folks around us. We try to look at, what providers charge, what insurance companies pay, what Medicaid pays. And so you can see that there are a few of these that we have increased. Now, I have to remind you, with public health, we might have a $900 fee on there, but our patients are charged on a sliding fee scale. So nobody's going to pay $900. But if Medicaid pays, let me look that one up so I can give you, I probably picked the wrong one to try and talk about. So let's see here. Let's do a D2394. Or why don't we do a 92, because I don't see that other one. Yeah. Well, no, that's not the one I want. D23. Well, Tim? 2740. Oh, yeah, okay. So that's, yeah. So a crown is $900. But Medicaid, it doesn't. Does Medicaid not pay for those, Amy? Medicaid doesn't pay for crowns. So that's not a good example. But the bottom line is, most of our patients are going to be 10% to zero pay. So they're not going to pay, but what will happen is we get credit for that service, and in the long run, it will help us when we're doing cost settlement. So that is why we try to do that, and especially if we're talking about a fee that Medicaid does pay for, which I sure would like to find one so I can talk like an intelligent person. D1516. Well, here's a good example. D1516. Our current charge on that is $420. Medicaid will pay $279.55. Other dental providers are charging like $420. Health departments are charging $520. Our charge is D1516, $420. We bumped it up $10. And so what will happen is Medicaid will pay us according to the services we don't get reimbursed. So if we only charge what Medicaid pays us, we don't get anything. But if we charge at least $10 above, we'll recoup that. But that probably doesn't even always cover all of our costs, honestly. So are there any questions about any of these fees?
Any questions on the dental fee section? Okay.
Okay. So our last fees, was that all of our fees? I thought we had some environmental health fees. There's no increase in those. So those are the only fees that we're asking for approval from you on. And these are submitted at the time we submit our budget to the county commissioners.
Okay, any additional questions for Susan? All right, hearing none, do I hear a motion to approve the fees, which include the clinical, the dental, as well as the environmental health, as presented?
So moved.
So I have a motion from Alan. Do I hear a second?
Second.
Second from Robert. Julie, we'll start on your end again.
Julie Mabe, aye.
Courtney Austin Wilson, aye.
Robert Brown, aye.
Marty Trotter, aye.
Max Semi, aye.
Carrie Hampton, aye.
Alan Ferguson, aye.
Mary Ann Evans, aye.
Amy Williams, aye.
Hope.
Hope Haywood, aye.
Thank you. Motion carries.
Chairman Trotter, I would like, if it's okay with you, I would like to recognize our staff that are here.
Absolutely. Yeah.
We require that all of our new staff attend at least one Board of Health meeting, and that they attend at least one county commissioner meeting. And so this is the most people I have ever seen at a Board of Health meeting that we employ. So when I call your name, it's like the Academy Awards. If you would stand up, I would appreciate it. So Sharon Inman works in finance. She is learning Darlene Hill's job and is her right-hand man. So we're happy to have Sharon. Sharon Brigman is our new billing person. She is replacing someone that left us and went to the state. Can you believe they would do that? I cannot. But we are thrilled to have her. She's very knowledgeable, and we're just, I think, real lucky to have found her. Thank you, Sharon. Elizabeth Nichols is a new nurse. Hey, Elizabeth. And she's just great. She's got the best personality, and she's been helping us do our vaccine clinics, and we're thrilled to have her as well. Jerry Lynn Stanley, another new nurse. Jerry Lynn's, you know, these nurses, I don't know what we would do without them. She's outstanding as well. And Jerry Lynn, now Elizabeth is going to be in clinic, but Jerry Lynn is a case manager. So she's going to be doing, are you doing CC4C or OBCM? CC4C? OBCM. She's doing pregnant women. So she's case managing those ladies. Thank you, Jerry Lynn. Then we've got Ashley Wilson. Ashley is a provider, a new provider. This position was asked for last year during COVID, and I think we asked for Sharon Inmans last year as well. We couldn't have done this when we were in the middle of everything and we were having to shift over from case management, contact tracing to vaccines the end of December. Ashley was extremely helpful, and she was like Lindsay Saunders' right-hand man. She helped Lindsay manage the vaccine, and she has helped us manage our clinics. She's watched what we do. She gives us feedback. She's kept her eye on everything that's going on. And honestly, she has been such a help during this whole time with our vaccines. Now she's starting to shift gears because we're seeing more family planning patients. And I know she's thrilled because she's actually getting to do family nurse practitioner work and not helping manage a clinic. But that's the thing about public health. We do everything. We don't look at people and say, that's not my job. It's everybody's job, and she's a good example of that. So, Ashley, thank you. Then we have Joanna Robertson. Joanna is one of our clerical support staff. She is in clinic, and she's another one that has done everything. I think everything but give a shot, and because she hadn't done that, she's not a nurse. We couldn't make her do that. That would have been illegal. But she manages our deaf and hearing TTY phone. She makes appointments. She does everything we ask her to do. And again, she's getting into clinic now more because we're doing more regular clinic stuff right now. And we want to keep it that way. So, you know, we don't want anything to happen that would keep us from doing it that way. So thank you, Joanna. We appreciate you. And then last but certainly not least is Christy Allred. And Christy is our new environmental health specialist. It's been a while since we've had a new one, and we're thrilled to have her. We stole her, which makes it even better, from Alamance County. And there she was doing some preparedness work and environmental health work. We've had her she's been helping us do vaccine clinic just like everybody else. And so, Christy, thank you so much. We we have an outstanding team. And, you know, again, we don't silo our jobs. We know there's a public health job that has to get done, and we do it. It doesn't matter where we're coming from, what we're doing. I mean, I get out there and direct traffic if I need to. I've done that for years. It's not a problem. But I haven't needed to, so I'm not going to claim that because these folks have taken care of it. There wasn't a need for me to be there. So we appreciate each and every one of y'all, and of course we appreciate all of our staff that we have at the health department. Thank
Absolutely.
you.
Thanks, Susan. Thank you guys for being here tonight. We appreciate your service and working. This is a great department, and I think you already know that. So again, we do appreciate you being here. So next is the COVID-19. By the way, this will be your favorite meeting. The next one will be a whole lot more boring. Isn't that right, Hope? There she goes. All right, Tara, we're going to have our COVID-19 update.
Adjust this. Susan's a little bit shorter than I. Good evening, everybody. It's really good to see everybody in person again. Zoom just doesn't, it makes it, but you know, this is much better. But I am going to provide you all with an update on testing and vaccine. I think Susan's going to give you all a little more of an update on where we are COVID case-wise. Maybe not? Whoops. So I'll just give a quick COVID testing update because testing is declining, except for talking to Dr. Brown earlier. He was saying he is seeing an increase in testing. What we're seeing here in Randolph County is when we get our weekly report from the state, we're seeing about 1,500 tests now per week. And just to give you a little bit of comparison, back in January when we were at peak, we were seeing about 3,500 tests per week. I've changed pages too quick. In addition to our local providers that are continuing to provide testing, StarMed continues to be set up in the community. They're still at the RCC, Archdale, and Asheboro locations. When testing started to decline, they did reduce their days of operation. They're now in Archdale just 2 days a week, and they're in Asheboro 3 days a week. I asked for numbers this morning just to see what kind of turnout they're seeing. They're averaging about 6 tests per day, so if that's any indication. And they were seeing 50 to 60 back in the peak. So that's testing. Shifting gears to vaccine. You all remember back in the beginning when we first had vaccine, the interest was pretty intense, especially when we hit the 65 plus age group. We just couldn't keep up. You remember when the phone line went live, it crashed. With the help of IT, they set us up with a call center, and it managed the hundreds of calls that we were receiving. Well, around the beginning of April, the interest in vaccine just all of a sudden kind of dwindled down. I wouldn't say to nothing, but it went from, we did a 180. We were getting, on average, 1,170 doses a week, and we were able to get rid of that. First week of April, we got 1,170 doses. It took us 5 weeks to get rid of those 1,170 doses. So that's a statewide problem. Vaccine is readily available for everybody, so I think we just reached a point where everybody that was really interested in the vaccine had taken the opportunity to get it, and then we just reached a population that is still hesitant to get the vaccine. So instead of the state continuing to allocate us vaccine, whereas they were saying, this is how much we want to send you, can you use this vaccine? They've shifted gears and they're allowing providers to now say, this is how much vaccine we think we can use up, can we get this much vaccine? So that's been helpful. Having decreased interest has afforded us the ability to do a little bit more in the community. We were doing this before vaccine interest declined, but I don't think we had shared it with you. We've been partnering with EMS since the beginning of the pandemic, but we had some folks, I know hospice would reach out to us and say, we've got some folks that are homebound. Can you all help us get these homebound individuals vaccinated? We called up EMS. They're like, absolutely, we'll take it out there, give it to them, monitor them, and then we'll go back in the 21 or 28 days and we'll do it again. So we've been in the community in that capacity. But last week, like I was saying, with the decrease in interest in vaccine, it gave us the opportunity to get in schools. Since we had Pfizer vaccine, those that are 16 years of age and older are eligible for that vaccine. So we partnered with Asheboro City, Randolph County, and URA Charter. And we were able to go to Asheboro High School, Eastern Randolph High School, Randleman High School, Wheatmore High School, and URA Charter at County Academy last week. And we were able to give a little over 100 vaccines. We were hoping to do a little more than that, but that was a good starting point. We were satisfied with that. And we plan to continue offering that, especially with the schools that are going to be having summer school this season. Plus, if the FDA will approve Pfizer for 12 to 15, we will continue to work with schools to get those kids vaccinated as well. Where we are in Randolph County as far as getting folks vaccinated, as of today, Randolph County residents that are vaccinated with at least one dose were at 32,767 people, which is just under 23% of our population. 29,950 people are fully vaccinated, which is just under 21% of our population. When I give those numbers, I have to remind folks that we have to keep in mind that 36% of our population is 18 years of age and younger. So there's a decent amount of our population that isn't quite eligible for the vaccine just yet. We're hoping that number will be a little less, of course, when we go to 12 to 15. Randolph County Public Health, just us, as one of the providers in Randolph County, there's 19 right now that are actually eligible to administer vaccine. But Randolph County Public Health, since the end of December, has administered 14,073 first doses and 13,235 second doses, which makes a total of 27,308 total doses. And I'll just put it out there too, that we've received 13,565 total first doses, which is 48% of the total vaccine that has come to Randolph County. Now remember that our numbers aren't going to match because our vaccine comes in vials. Like in the beginning, Pfizer, when it first came out, it was a 5-dose vial, but we could get 6 doses out of it. Moderna is the same way. It's a 10-dose vial, and sometimes we could get 11 doses. So what we've been allocated and what we've administered don't exactly line up, and that's the reason why. So what are we doing to help increase interest in vaccine? Well, if you look at our Facebook page, you've seen that we now have an Instagram. We now have a TikTok. Haven't seen any of that stuff yet, but we're moving up in the world. Our health education team is currently working on a Bring Summer Back campaign. That's an NCDHHS campaign. It's a community-centered approach that's encouraging folks to get vaccinated. Some of the things that our folks are doing right now is they're reaching out to influential individuals in the community of all ages. And they're working to do video recordings of these individuals in support of vaccine. Like when we were at the high schools last week, we got teenagers that have influence over their peers. We've reached out to Teresa Shackelford, Dr. Shackelford. His name escapes me right now, but the director of the YMCA. Those are just a few to name that we've reached out to that are willing to support and do a video recording encouraging vaccine. If you guys saw the email that I sent Friday with the weekly report, you saw that StarMed Healthcare is going to be offering a vaccine clinic in the Archdale area on Wednesday. Their flyer's actually advertising that they're going to be offering Pfizer, Moderna, and J&J. So if you guys will share that, that would be great. If it goes well, this will become a regular vaccine site. We've not been able to get up there into that area, so and I know it's a little farther away for some folks to get down here, so we hope that will be well received in that area. Just to plant the seed too, other efforts to increase vaccine, we had a meeting today with the North Carolina Zoo and StarMed. The zoo is also wanting to be part of the Bring Summer Back campaign, and they would like to have on-site vaccine events and encouraging people to come to the zoo, but while they're at the zoo or if they have future plans to come back to the zoo, if they'll get a vaccine and once they finish their second dose or their single dose of Johnson & Johnson, they will get a voucher for a return trip to the zoo for no cost. So details about that aren't finalized. We'll share that as soon as we know it, so cross your fingers. We think that would be a great event because right now, even at reduced capacity, the zoo is seeing about 4,000 people a day. So that could have a potential impact for the county. And even though people are coming from all over, we need to get these folks vaccinated. Another means of encouraging vaccine is we love to share the information about what fully vaccinated people, how, it opens up some flexibility. Once you're fully vaccinated, you can go visit people, hang out without wearing a mask or socially distance. We know in our office in administration, those of us that work in administration, we're all fully vaccinated. So when we get together and meet, we don't have to mask up and we can sit right next to each other. And like hugging Dr. Lee. I know Dr. Lee's fully vaccinated. I hope you don't care that I share that. But I can hug Dr. Lee. But we like to share that information. And another perk is, if you're fully vaccinated and you have an exposure to a positive case, you don't have to quarantine for 14 days as long as you remain symptom-free. To me, that's motivation, should be motivation enough. It impacts your ability to travel. You have a little more flexibility when it comes to travel. The current guidance says if you're fully vaccinated, you don't have to pre-test or quarantine when you get back, unless the testing part, unless your destination requires you to get tested. That's the same for international travel as well. No pre-test unless your destination requires, and no quarantine when you get back if you're fully vaccinated. And we still encourage people that even though once you get fully vaccinated, we still need to protect ourselves and others by following the 3 Ws. We know people are tired of it, but it's what it's going to take for us to get through this. Is, again, following the 3 Ws, wearing the mask, waiting 6 feet apart, and washing our hands. That's all that I have for the update. I'm sorry, Susan, that I didn't understand I was doing the COVID update. Does anybody have questions about testing or vaccine? Yes, ma'am, Mary Ann.
Is there any specific outreach plans for some of the minority communities?
Thank you for asking that question, Mary Ann. And we've been working with our minority communities since the vaccine started. We have reached out to some of the champions in the minority communities. We set aside appointments for those individuals, and our champions would send us names, all of the information we needed to get those folks scheduled, and we would get them in. There's been an occasion or two where folks have wanted us to come on site, and we've put StarMed in touch with them, and I know StarMed has been to at least 1, maybe 2 events in the community, so we are working with that community. And I do want to mention, too, that the minority community is also part of our Bring Summer Back campaign as far as the video goes, just because we know there's still some hesitation, just like with the other populations, with getting the vaccine.
Anybody else? Okay.
Tara,
Yes, ma'am.
have you guys reached out or heard anything from Gifford Del Grande?
Yes, I talked to or emailed Gifford pretty regularly.
Okay, so he talked to you about his son maybe making a video?
Yes.
Okay.
Yes, ma'am.
Okay, thanks, Tara.
If you don't mind, would you allow me to just take a second and say a few words about Susan?
Absolutely.
I feel like I need to take the opportunity because I can't believe we're down to 3 weeks and she's going to be retiring on us. Anyway, just quickly, and I will try not to get sad, but Susan is one of the smartest. I didn't have trouble writing this. Most passionate, hardest working people I know. She really is. And I'm not just saying that because she's my boss. Her passion for public health is unmatched. I wish you guys could see her day in and day out. She is passionate. I've never seen anybody as passionate about public health as Susan Hayes. When she assumed the role of health director 5.5 years ago, she hit the ground running. She hadn't stopped. She wears me out just watching her. Just to name a few of her accomplishments, from the beginning, this may not sound big, but it is big. She saw that clinic needed an electronic health record. We were still doing everything on paper. She saw that dental clinic the same way. Everything was on paper. They needed an electronic health record. She saw that environmental health was using an outdated state system to do inspections. She changed all of that. She ensured that each program had the data management program that they needed. She encouraged the Board of Health to adopt the rabies compendium. Even though that was going to be a temporary thing, she saw the importance and the need for that to be adopted, even temporarily, when she knew the state was going to eventually pass that. Those were the easy things. Then she initiated and pushed hard for the adoption and implementation of the Randolph County Government Grounds tobacco-free rule. She pushed hard for that, and it came to be. She strongly advocated for animal services to become a standalone department, and it worked. And I'll say that was when I moved into my position as assistant health director, when she moved into her position, that was one of the first things. She wanted us to look at what we could do to get animal services. She knew it needed to be a standalone department. Public health needs to do rabies, but we didn't need to manage the whole department. So she was passionate about getting that done, and she did. And last but not least, the county's response to the COVID-19 pandemic. She's led that response since before day one of having our first case here in Randolph County. She had the foresight to open the EOC before there was even, I don't even think there was a case in North Carolina yet. But she has foresight about things like that it's amazing to me. She's had a lot of criticism and pushback on some of the issues that she's pushed, but she's never let that affect her passion. She's never let that affect her commitment to the health of Randolph County and the residents that live here. We've been blessed to have her as health director for 5.5 years. I find it hard to believe that it's been 5.5 years. It seems just like yesterday that she was moving into that role. But she is well respected by many, me being one of her biggest fans, and she's going to be greatly missed. I think I speak on behalf of the public health team, but we do wish her best. It's a bittersweet time. As happy as we are for her, we're really sad for us. But we do know that she's just down the road and she's a phone call away. And we do wish her a happy retirement in hopes that she's able to enjoy it to the fullest, spending time with that grandbaby. Thank you.
Thank you, Tara. We're going to have some comments for her in just a little while, but I'll let her speak first on her health director's report, if that's okay.
So let's see here. So there's a couple of things that I wanted to address before we finished up tonight as far as COVID-19. We so far have had 14,993 total cases of coronavirus since March 23rd of 2020. Right now we are sitting at 4.5% positivity rate, and I will remind everyone what that means is of those individuals who get tested. So when we have folks go get tested, 4.5% of those tests come back positive. The goal is less than 5 or less. The lower the better. Chatham County's sitting over here with like a 2% positivity rate. Makes me very envious. But you know, Chatham County's different from Randolph County. 4.5% is great. I would love to see that keep going down. We're sitting at about 139 cases per 100,000. When they do when the state, they do it every other week, the COVID-19 county alert system. Right now we are still in Orange County. So the lower, and part of that, part of those metrics has to do with the number of cases per 100,000. So the lower we can go with that, the better as well. And we have, if you look at all that, that gives us about 16 cases per day, which is phenomenal, because I remember when we were getting over 100 cases a day. I mean, it was unreal what we were dealing with. But we are sitting at about 227 deaths. And I have to mention, you know, this pandemic has really touched our county family in a tremendous way. We have a nurse who just marked the year anniversary of her husband who died of COVID-19, and her father-in-law. And they both died very shortly, in a short time within a short time of each other, and her husband was one of our first deaths in our county. He got COVID-19 from work. He was a supervisor, and he was screening people when they came through. She's been very public about that, so I don't mind mentioning that. She's been in the paper, and I think interviewed by TV early on, because she is now fully vaccinated, even though she and her mother-in-law both had COVID. The most recent event that happened was we lost a very dear friend to all of us, because we all knew him, who worked in our maintenance department, to COVID. He was 54 and too young to die. So I think his funeral services are tomorrow. So it is a real thing. It's something that we've worked really hard over this last however many months to try and keep people from experiencing what his family has the loss that they're all feeling, and the nurse that works for us, the loss that she continues to feel. You don't know if you're going to be one of those people that has a serious illness. You know, the best way to prevent that is to get a vaccine. And I don't know how to convince folks to do that, but I sure do wish they would. We have recently seen a change in schools. You know, schools are back in going in class, and that is creating problems, but not so much at school as it is out in the community. We've had a number of school regions. The parents have decided to go together and do a prom for those regions. And you may have seen some of the pictures on Facebook. There was a prom held back on April 23rd, and right now I know of 11 cases that have come from that prom. And one of those individuals is in the hospital right now. My understanding is there were several other proms sponsored by parents and other community members held over the weekend. I don't know what to do about that. I don't have any authority to have them not do that. But if any of those folks are watching tonight, I'm begging you, please don't have any more. You've got less than, 2 full weeks of school left? If you got to do it, wait till school's out. Because what happens is, the kids will go back to school if they don't know they're sick, and they expose other children. And we've got end of grade tests, we've got AG testing going on right now. We've got things that students don't need to miss. So, my plea is that parents, please think, don't do that. I know it seems like your children are missing something, but right now all they're missing is getting sick or having somebody end up in the hospital. So, the other thing I wanted to mention is, I want to remind, we've got, especially since this is my last meeting, I want to make sure that I say the things I want to leave you thinking about. Our chances right now of getting out of this are pretty good if people will do what we need to do. Wear a mask, social distance, wash our hands, but above all, get a vaccine. If that happens, that's the best scenario in the end that we could hope for. But if it doesn't happen, and let me remind you, we're the ones in control. Do we have control over coronavirus? We don't to a point, but we do more than we think we do. We do because we can get a vaccine, we can wear a mask, we can social distance, we can wash our hands, we can tell it to go away. But if we don't do those things, the virus will take its opportunity to create another version of itself that is much more virulent, much more likely to spread, and could make people more sick. And should that happen, and our folks are not vaccinated, and we don't get herd immunity, we're in the worst situation we could be in. So my message to everyone tonight is to please get vaccinated, get your family vaccinated. If you can't find a vaccine, call us, we'll find one for you. We'll make sure that you get it. It's imperative that we get out of this and keep everybody we love as safe as possible. There's one other thing I'm going to read a long time ago. I don't sing for a living, y'all, so, and you're better off because of it, let me tell you. Mimi Cooper, who I'm going to, we do a little, we've got an employee newsletter, and when you retire, they want to put a little something in there. And so I worked with health education, and we wrote a little something to go in there. But I wanted to recognize a couple of public health champions in my life, and that was George Eliot. A lot of y'all won't know George. You might, Alan. Did you know George at all?
Just
a little bit. George was health director when you went out and down east when there was a hurricane and you had to go hunt up coffins that had, I can remember him telling us stories about going up because the coffins would pop up out of the ground and they'd have to go find them, go fish them up. He is the reason we have a WIC program in Randolph County. Randolph County had held out forever about having a WIC program, and George went to bat with the commissioners, and he got a WIC, one of the last counties in North Carolina to get a WIC program. But George hired me, and had he not hired me, I would not have gotten to fulfill my dream of working in public health and being the WIC director. I had always loved infant and maternal nutrition, and that was one of my passions, and my passion for public health just sort of grew from there. The other person I want to mention is Mimi Cooper. And had it not been for Mimi, I would not be health director probably. So I appreciate her very much. She was a good teacher. She was a health director for a long time. She left, I think, with like 36 years of service to Randolph County. And so I'd be remiss without thanking her and mentioning her. And there was somewhere along the line in my history with Mimi, we had several adventures, from running up hogs and pigs in the woods because they got out of somebody's something, and animal control was called and we didn't have enough people, so me and her were out in the woods trying to catch pigs. There were lots of stories. I got up, most of my adventures with her had something to do with animal control. I remember having to drive an animal control truck at 1 o'clock in the morning to go pick up cats in Seagrove that a woman had in her house, and there were thousands of them. And we had like 3 or 4 animal control trucks. So do you see why I thought animal control needed to be its own department? But we had lots of, like I say, we had lots of adventures and a lot of good times, and I appreciate Mimi tremendously. But there was something we did, ran across, and I can't remember if it was, I don't remember the details, but there's a poem, and that she and I liked. We had used it several times, and I'm gonna read this poem. Some of you may have heard it before. But this poem was written in 1895. Now, John Snow, who's the father of public health, figured out what was going on with cholera around 1858, I think, something like that, in England. And so this wasn't that many years after that. So, and this gentleman who wrote it is British, so there's references in here to British references in here. But the meaning is how important public health is in the community. And the name of the poem is A Fence or an Ambulance. 'Twas a dangerous cliff, as they freely confessed, though the walk near the crest was so pleasant. But over its terrible edge there had slipped a duke and a full many peasant. So the people said something would have to be done, but their projects did not at all tally. Some said put a fence around the cliff edge. Some said an ambulance down in the valley. But the cry for the ambulance carried the day, for it spread through the neighboring city. A fence may be useful or not, it is true, but each heart became full of pity for those who had slipped over the dangerous cliff, and the dwellers in highway and alley gave pounds and gave pence, not to put up a fence, but an ambulance down in the valley. For the cliff is all right if you are careful, they said, and if folks even slip or dropping. It isn't the slipping that hurts them so much as the shock down below when they're stopping. So day after day, as these mishaps occurred, quick forth would those rescuers sally to pick up the victims who fell off the cliff with their ambulance down in the valley. Then an old sage remarked, "It's a marvel to me that people give far more attention to repairing results than to stopping the cause, when they'd much better aim at prevention. Let us stop at its source, all this mischief," cried he. "Come, neighbors and friends, let us rally. If the cliff we will fence, we might almost dispense with the need for the ambulance in the valley." "Oh, he's a fanatic," the others rejoined. "Dispense with the ambulance? Never. He'd dispense with all the charities, too, if he could. No, we'll support them forever. Aren't we picking up folks just as fast as they fall? And shall this man dictate to us, shall he? Why should people of sense stop to put up a fence while the ambulance works in the valley?" But the sensible few, who are practical too, will not bear with such nonsense much longer. They believe that prevention is better than cure, and their party will soon be the stronger. Encourage them then with your purse, voice, and pen, and while other philanthropists dally, they will scorn all pretense and put up a stout fence on the cliff that hangs over the valley. Better guide well the young than reclaim them when old, for the voice of the true wisdom is calling. To rescue the fallen is good, but 'tis best to prevent other people from falling. Better close up the source of temptation and crime than deliver from dungeon or galley. Better put up a strong fence round the top of the cliff than an ambulance down in the valley. Thank y'all.
Thank you, Susan. If you'll stay put for just a second, Susan, we, as a board, certainly appreciate your 34-plus years of service to this county, and certainly the last 5.5 years as a public health director. You had a daunting task without a pandemic thrown on top of it. Obviously, chasing hogs and cats late at night is not a job that many would want to be encouraged to apply for anyway, but certainly we appreciate your help. I know over the years I worked with Mimi and then you, and I think Darryl Fry told us last commissioners meeting that in 39 years there'd only been 3 public health directors. So the longevity's there, the tenure's there, and so we certainly appreciate all that you've done to keep the citizens in Randolph County safe. One of the things I remember growing up as a kid was there was a company picnic and there was a lot of sickness. There was, I can't remember all the specifics, but I remember hundreds of people got sick.
It was a barbecue
It was a
at
barbecue
Eveready.
from a company, and I'm sure the health department was heavily involved with that at that point, and that's just one of the examples of things that you guys do. And as a board, we certainly appreciate you. It's been a pleasure working with you.
Thank you.
I hope you'll find time to be a wife and a mother and a grandmother to your special family, and take some time for yourself, because it's well deserved. And so, from the board, you'll come up. We'd like to give you this, and also we know that you're heavily involved with the Partnership for Children. And so in addition to the gift for you personally, we wanted to make a donation in your honor to the Partnership for Children, because we know that's something special to you. So thank you. Charles Lee, we're so glad that you came with and joined us tonight for her last meeting. I worked with Charles on this board for several years, and he was a chair. And so I reached out to Charles and some of the other the ones that had rotated off. So we appreciate certainly you being here. If there's anything you want to say at this time, Charles, feel free to do that.
Well, it's been a pleasure to work there. I did there, up the board, all these folks that working with Susan and Tara and all the board members, the staff. Unless you've been involved with the board, very, very few people in this county understand how much work these guys do. And they are being highly commended. They are all dedicated, they work hard, and I think we owe them appreciation.
Absolutely. Anybody else want to speak? Okay.
All right. Here's a motion for closed session for Monday night. I move that the Randolph County Board of Health go into closed session pursuant of North Carolina General Statute 143-318-11A6 to consider the qualifications, competence, performance, character, fitness, conditions of employment, or conditions of initial appointment of a public officer or employee.
Okay, we have a motion to go in closed session. Do I hear a second?
Second?
Is that Amy? Okay, Amy. So Julie, one more time, we'll go through the list.
Julie Mabe, aye.
Courtney Alston Wilson, aye.
Robert Brown, aye.
Marty Trotter, aye.
Max Semi, aye.
Carrie Hampton, aye.
Alan Ferguson, aye.
Mary Ann Evans, aye.
Amy Williams, aye.
Hope?
Aye.
Okay, thank you. So we're now in closed session. We appreciate you guys being here with us tonight. Thank you.